My name is Anastasia Romashkina. I hold a PhD in medical sciences and work as a physician in dermatology, cosmetology, trichology, physiotherapy, and I am a certified coach in both device and injection-based techniques. Closed collagen-based products are unique in their composition and allow for targeted treatment of wrinkles, reducing their depth and firming the skin. These products are inert and hypoallergenic, enabling us to work with any patient, including those with an allergic history and with patients of any age starting from 18 years old. Our patient is scheduled for a series of three procedures. The first one using Collost Micro at a 6% concentration, the second one using Collost Micro at a 10% concentration, and the third one using Collost 15%. The Collost Micro product is supplied in a form that must be hydrated and then converted into a liquid state. An instruction sheet and a barcode to be affixed to the patient's outpatient record are provided. To prepare a Collost Micro at a 6% concentration, we add 2.5 milliliters of a 0.9% sodium chloride solution and hydrate the product. The key is to begin the hydration process as quickly as possible. Immediately after adding the saline, shake the vial vigorously so that the Collost Micro dissolves rapidly. The quicker the hydration process, the better the substance dissolves. When treating the neck area, special attention is paid to the Venera rings, the so-called horizontal static wrinkles. In our patient, these are quite pronounced. Such wrinkles frequently form in the transition zone between the neck and the décolleté. The technique is characterized by the fact that the product is not distributed evenly over the entire neck. Rather, we focus initially on the problem areas. We identify the existing Venera rings and the skin pinch observed in the transition area between the neck and the décolleté, and we do not neglect the transition zone from the chin and lower jaw to the neck. These are the main problem areas. To achieve thorough correction, we perform injections papule by papule, creating a line of sufficiently dense product distribution with controlled micro-traumatization that resembles linear injections, yet with minimal bruising. In this way, we are creating an imaginary necklace on the neck. After treating these areas, we place intradermal papules in the spaces between. They are positioned very close to one another, zero point 0.3 millimeters apart. This technique accentuates existing skin pinches and firms up the tissues in the areas between wrinkles. When working on the neck, we always include the décolleté area as well. A key aspect of collagen therapy is the use of intradermal injections. The papules contour after the injection and are visible on the skin as swollen bumps. A hallmark of intradermal injections is the tissue resistance felt during injection. A slight resistance confirms that we are in the dermis. When the resistance disappears, it indicates that we have gone too deep and are in the subcutaneous fat layer. Now we are treating the horizontal neck wrinkles, one by one, forming papules one after the other. We also treat the transition zone from the lower jaw and chin to the neck to firm the area. Injections may be performed using 32 to 33 G needles. After treating these areas, we place intradermal papules in the spaces between, positioned very close to one another, approximately 0.3 millimeters apart. Next, we move to the other side and similarly correct all the horizontal static wrinkles by administering papule by papule injections. As observed, on the other side, the papules become redder and slightly larger, which is a normal reaction to Collost. For post-procedural care, we use Collost spray, which contains collagen, hyaluronic acid, hexapeptide, and lutein, helping to quickly soothe the skin and reduce hyperemia following the injection. Hello, my name is Anastasia, and I have just undergone a Collost procedure on my neck. Usually, we tend to care more for the face, and the neck often appears much older than it should. The procedure was painless and quick thanks to the use of anesthesia. I'm looking forward to the results.